Everyone. So just a little bit more about me is I'm here to share about my unique approach to healing from Lyme and tick-borne diseases, and this might also be different from kind of anything that you've heard anywhere else. So try to talk slowly, and we'll have time to answer questions at the end. And so I'm a naturopathic doctor. I specialize in Lyme disease. I practice in Greenfield, Massachusetts, but also now through telemedicine, really working with people all over the Northeast and all over the country. And I'm here to share some of my unique approach to recovering and healing from Lyme disease that I've learned from working with hundreds of patients at the Windhorse Naturopathic Clinic in Brattleboro, Vermont, and also from my family members, as I mentioned, that I have my husband's family. My in-laws are from upstate New York, from Albany area and Capital Region, and so I'm very familiar with also the day-and-day up and downs of Lyme and how that can be. And we know, a lot of you guys know, Lyme is often misdiagnosed. Treatment has been prolonged, which, causes more complications. And, you might be someone that's already been on a standard course of antibiotics for Lyme disease, or you've even tried herbs or natural things and still might be feeling sick or feeling frustrated. So we're going to go over some things together. So tonight you're going to learn what a holistic approach to Lyme and tick-borne diseases might look like, along with a short introduction to what naturopathic medicine is. We'll talk about why you might still be sick, even though your labs are quote unquote normal. Maybe you've been told that you're healthy, there's nothing wrong with you. You've taken the antibiotics, so you don't have Lyme anymore. And we're going to talk a little bit about my unique approach to Lyme recovery. So again, just sharing a little bit about my story is, so because a lot of my family is from Albany, New York area in Columbia County. It's one of the highest, endemic areas for Lyme. Pretty much like all the dogs and all the all the human family members have either had Lyme, have it, are recovering from it. And I see all the suffering, the debilitating fatigue, the nerve pains, the ups and downs with not knowing how you're going to feel day to day, week to week. And for me, it was just like horrible to watch all of that, right? And that's why some of us are here as family members, to watch that and feel kind of like despair and watch the suffering and feel kind of hopeless. And when I was in Seattle studying to become a naturopathic doctor, my husband started pursuing some of the Lyme treatments that were out west in Seattle, because even though, we don't think of like West Coast or Washington as like a big Lyme area, that is where a lot of the holistic treatment options that are not only focused on the antibiotic approach kind of came from. And I started learning a lot from just the treatments that he was going through. And it was really overwhelming and confusing, like learning about how so many different doctors treat in so many different ways. And I've really learned the most about Lyme and tick-borne diseases and how to treat them from treating hundreds of patients that I've helped with all stages of Lyme disease. And I really owe a lot of my systems and way I treat people from working with them. And I'm here today offering this because I want people to know that there's other options available that don't include only taking antibiotics for years at a time, which I've found just working with a lot of people that it just often doesn't always work. Either at some point, the antibiotics stop working and you reach a plateau, and I'll go into all the details and the mechanisms behind why, but really, simply in layman's terms. And then, I used to kind of really think that was the only option, was long-term antibiotic therapy. And before I learned that there were other options, and before I started practicing medicine myself, and just saw some of the harm that was happening from that. And really, there's no judgment if that's the treatment that you're following or your family members are following right now, long-term antibiotic therapy, because for a lot of people, that's the only choice for various reasons. And I just want you to know that there are other options out there that I think are a little bit more safe and more effective. And I have patients that stay on long-term antibiotics or stay on them for a while we're transitioning. And it's not like a you have to choose one, side of the camp or the other for, I don't believe in those kind of dichotomies. I think it can be more nuanced than that. And just a little bit more about me. This is me at the Blue Dragon Apothecary here. Oops, trying to put this down here. Hold on a sec. This is me at the Blue Dragon Apothecary, and I'm mixing up my Cedar Rose signature tea. And people are kind of, like I said, I'm working with people from all over the Northeast and all over the country right now. So, and I went to Bastyr University. It's a 4-year in residence full-time naturopathic medical school in Seattle, Washington. It's recognized by the Federal Department of Education. And I practice as a Vermont licensed naturopathic doctor, even though I'm in Massachusetts. And in Massachusetts right now, we're, we have been licensed, but we don't have our board yet, so we don't actually have our licenses. So I practice under my Vermont license, which has a much larger scope than in Massachusetts. But in Massachusetts, I'm more limited because we're not licensed yet. There's limitations around, I don't prescribe medications, or there's only certain labs that I can order. It's a little bit more limited at the moment. But I do 20 hours of general continuing education and 10 hours of pharmacology continuing education every 2 years for my Vermont license. And I've attended a number of conferences with Dr. Klinghardt, who you might be familiar with. He's a Lyme literate medical doctor that mostly focuses on, he has conferences on healing Lyme without antibiotics, and he's out in the Washington State area. I'm also a member of Massachusetts Association for Naturopathic Doctors and the American Association for Naturopathic Physicians. So as was mentioned, I had 3 years mentoring under Dr. Emily Mayella at Windhorse Naturopathic Clinic, which, if you've kind of been looking around this area of different Lyme literate doctors, you might have come across it at some point, because it is a specialty clinic that focuses on Lyme disease and autoimmune disease and chronic illnesses. I also was practicing primary care there, so I really got to work with patients in the acute stages, intermediate stages, and late stages of Lyme disease, and I've really learned the most from them. And so one thing that I'll talk about in terms of a naturopathic philosophy, and that's sort of a unique thing that you might have heard of if you kind of look up naturopathic medicine or holistic medicine, is the idea of treating the whole person. And that's kind of looking at what's going on in the whole body, as opposed to, conventional medicine. Most nurse practitioners, medical doctors, physicians assistants are trained to kind of look at okay, one thing at a time, and more specialists and things being compartmentalized. And in most traditional medicines and naturopathic medicines, we're trying to look at what's going on and how are things interacting in the different systems. So that's one thing that's unique. I'm not just focusing on how to kill pathogens, but I'm focusing on trying to treat the whole person. And that's one of these 6 naturopathic principles. There's also the healing power of nature. And that's the idea that we all have this inherent healing capacity in us. Basically, that's sort of an architecture for healing. And in Chinese medicine, they call it qi. In Ayurvedic and medicine and in yoga, it's called prana. So a lot of these traditional medicines have this idea that we can work with this inherent, nature that we have in us, and that really wants us to focus on health and healing. And also another thing we do is identify and treat the cause, which I will go into more detail later. And identifying and treat the cause, sometimes there's many causes, especially when you get into complex sort of chronic infectious diseases, and any chronic disease really in general. There can be many causes, and it's also a little different than in conventional medicine or Western medicine, where we're pretty satisfied with just treating the symptoms, treating the pain, or even heart disease, right? It's you don't always go to the doctor, and they don't always talk about prevention, which is also one of our principles. But you know, and that sometimes is because of the insurance companies more than the doctors or the nurses themselves. Insurance dictates how much time doctors can spend with their patients, right? So there's not often a lot of time to talk about nutrition and exercise for, you know, heart disease or something like that. Whereas like that, and that's so foundational, and that's a big part of what we do too, as doctor, as teacher, working with people to educate them on how to stay healthy, how to get healthy. And we also have first do no harm. So there's a therapeutic order, naturopathic medicine, where we have like drugs and surgery on one side, and we have things like nutrition and exercise on the other side, and then everything else is kind of in the middle. You know, we have hydrotherapy and physical medicine. Hydrotherapy is using water therapy to manipulate the body in different ways. And there's physical medicine, which kind of include like, you know, adjustments and chiropractic medicine and body work and massage, that kind of a thing, fixing things structurally. And then you kind of get into the more of the medicines, like supplements and herbs and things like that. And we try to we're always trying to go further, as far down like the line in terms of harm as we could, so we don't, you know, and that's why people come to us a lot, because we're not jumping to the drugs or the surgery right away. But of course, if you have an emergency, you need the drugs and the surgery. So, you know, it's all about meeting the disease and the person where they need to be met. And what's unique, traditional medicines in general, and I kind of count naturopathic medicine as like a traditional Western medicine. There's an emphasis on health rather than on disease. And generally the focus is on like the overall condition of the individual instead of focusing on the ailment or the disease. So even that's why somebody might have the exact same sort of diagnosis in, you know, Western medicine. There might be like Lyme disease caused by Borrelia burgdorferi, but there also could be Babesia, and maybe they both have the same diagnosis, but the two people could be in completely different places. Like maybe someone else also has an autoimmune disease, or they also have heart disease, or one person has been sick for longer. So that's why we really individualize. We look at the individual, not just the disease. And you know, the use of herbs is usually a core part of many systems of traditional medicine. And again, what I've found in my practice from treating hundreds of patients in all stages of Lyme disease is that most people who are on a treatment plan that only focuses on long-term antibiotic or antimicrobial therapy, whether it's pharmaceutical or herbal, is that a plateau is reached at a certain point, and then at some point things just stop working. And again, I'm talking about sort of more intermediate and chronic Lyme and tick-borne diseases, and I will get into the tick-borne diseases if you're not familiar with that term. It's like a general term we use for basically anything you can pick up from a tick and get sick from. So the different phases are just very briefly, like acute phase is from up to maybe about 3 months, 72 hours to 3 months of illness. And then intermediate is about 3 months to a year, and chronic is a year plus. But I always advocate for my patients to follow the ILADS guidelines, International Lyme and Associated Disease Guidelines of 6 weeks of antibiotics, usually doxycycline if your age is 7 and up. You know, so I'm not talking about the acute where you have to have, it's really important to get the antibiotics. I'm talking about like people that have been on antibiotics for years and years, or months and months. So I just want to go through this story. Let me just check. Let me see if I want to check if anybody else needs to be admitted here. Just give me a minute, because I don't know if I can do that. Well, I have to stop the screen share. Okay, give me 1 second. Yep, there's a couple of people waiting to be admitted, so let's just let them join. All right, and then I'll go to the screen share again. And again, if you have questions, feel free to type them in the chat. Okay. So this is a patient story I wanted to share from a 23-year-old woman who really felt helpless and like giving up. And it's just a good story to illustrate one of the stories to illustrate the pitfalls of only following an antimicrobial approach. I had this one client who came in, you know, she had been to another clinic for Lyme disease. When she came in, she felt helpless. She just really wanted to give up at that point. She didn't feel like she was listened to by her doctors. She didn't feel like her doctor got her at all. And her body and her mind were just really ridden with pathogens at this point. And she was debilitated. She felt like giving up. She couldn't go on walks or social outings. And she was, I think, 23. Yeah, I mentioned that. So she, you know, she was pretty young at the time. So kind of a hard time to not be able to work and not be able to go out and socialize. And she had searing joint pains. She had really bad insomnia, anxiety, heart palpitations, and brain fog. And she was unsuccessfully tried on some psychiatric medications, which kind of made things so much worse. And she had already been on multiple rounds of antibiotics when she came to see me, and was sick for about 2 years at this point and just wasn't getting any better. Like she, you know, would get better with the antibiotics and then she'd get worse. And I'm going to go through some of these things in more detail in a little bit. So don't worry if these are new concepts, but she did get tested for chronic viruses and co-infections, which we use the term co-infection for. Like Lyme is caused mostly by Borrelia burgdorferi, or any other Borrelia species, and then the co-infections are things that you can get along with Lyme, like Anaplasma or Babesia or Mycoplasma, for example, and there's more than that. And we tested her for those. We tested her for chronic viruses and depleted organs and systems, and it really wasn't until we supported her adrenal glands, her brain, her thyroid, and her liver that she was able to start feeling better. And after 2 months, she slowly started to improve in energy, digestion, brain fog, anxiety, and joint pains. And I'll just reiterate that, like, we didn't really, because she had already been doing antibiotics. She did stay on the antibiotics at that time, but that wasn't the first thing that I did with her. It was like really like, okay, let's figure out what's weak and what needs to be supported. Because otherwise I find it's sort of like pouring coffee like down the drain. It's like there's nothing to like, there's no foundation to stand on if you just sort of keep pouring these medicines in there and they're not really getting anywhere. So 2 years later, she reported feeling 75 to 90% better, except for occasional flare-ups. And she says she feels joy at times that she really never felt before. She can work, she can socialize. She was able to have a boyfriend at some point, and they moved in together, and she even got married recently, and that's like 3 years later. So it's just really amazing to see how far she's been able to come. And what I found is from working with my clients is that if we assess for weakened organs and systems like the small intestine or the immune system, and we found out what's weakening them, and then we strengthen and we build them, you can actually recover from Lyme disease and also have less flare-ups. So again, just some of the pitfalls of only following an antimicrobial therapy for a tick-borne disease in the intermediate and late stages. You know, it can be frustrating just going to multiple doctors, trying different treatments, not knowing maybe even who to listen to, not getting better, not knowing what's going on. So what's missing and what was missing from my patient's care is what I see: not addressing weakened organs and systems which have been damaged, and really the shortfall of not addressing depleted organs and systems is that you could stay sick for a long time and bedridden. And I think we've all know people, maybe we've been there ourselves, or we know people like this. And, you know, what else did I want to say about that? Oh yeah, so tick-borne disease is also just like a catch-all term that we use for anything you can get from a tick, pretty much, tick-borne. And so there is also viruses, something unknown that's not always that talked about, that I'm hearing more and more is like, oh, there's also some viruses you can catch from a tick, such as heartland virus, which I'll get into a little bit later. And but some of the common tick-borne diseases, you know, are ehrlichiosis, anaplasma, Babesia, Bartonella, Mycoplasma. There's probably more. I know I'm not naming them all. But it's frustrating when you're told that nothing is wrong with you and you're fine, and that kind of relates back to treating the whole person and trying to find the cause of the problem. And I really like Dr. Horowitz's kind of catch-all phrase for like multi-systemic infectious disease syndrome. So I feel like it catches a little bit more than just saying Lyme disease or tick-borne disease. But I mean, we use those terms, I think, because people are familiar with them. But he has that acronym MSIDS, and he has like a whole questionnaire you can follow. But it's basically this idea of like a system complex of Lyme disease and multiple tick-borne co-infections that encompass not only the infections with Borrelia burgdorferi, which is the main etiological agent of Lyme, but it's also other bacterial infections, viral infections, parasitic infections, and fungal infections. And naturopathic doctors are kind of really suited and trained to look at how all the systems and are related to each other and how to treat someone in this more integrated way. Whereas I was saying before, MDs are more and more just trained as specialists to look at one part at a time, and primary care doctors are kind of just shuffling people from one specialist to another, and can be really frustrating. And I know kind of as on like the on the end of trying to help people coordinate care, it can be very frustrating. And also naturopathic medicine, the approach to healing is more based on strengthening the systems with nutrition, herbs, supplements, and what we call like the foundations of health. So rest, sleep, clean air, clean water, good food, good nutrition, so that you're more strong from the inside and that your immune system is strong and you can fight off the pathogens, what we call again of strengthening the vis. And the idea, it's a Latin term, the vis medicatrix natura, the idea of like the healing power of nature. And believing again that there's this inherent nature in us humans that is healing, as opposed to only focusing on killing things. And of course, sometimes we're doing all these things at the same time or at different times. And I do find that this is often missing from a lot of Lyme literate practitioners' approaches, even from people who have been trained in functional medicine and holistic medicine. And it's just why it's important also with chronic infections that we know there's so much damage from all the inflammation from the chronic infections. And if you kind of skip over the inflammation side of things and you don't address that, you don't address the damage that's been done, again, it's really just pouring good coffee down the drain, and who wants to do that? So I want to share this. This is something I came up with for talks, but also just for sharing with when I'm with clients, because I find it's helpful to go through 9 reasons why you might still be sick, even though your labs are quote unquote negative or normal, and you've taken antibiotics already. And I'll go through some of these. We're not going to have time to go through every single one tonight. And there's probably, more than 9. This is just a good start. But we've sort of talked a little bit about unknown co-infections. We've talked about the depleted organs, and that's pretty much what we've gotten to so far. But you can see there's some more, and we'll get into more of the details of this in a little bit. And then this is also something that I've created. There's a Lyme recovery system, and one of the important steps is decreasing inflammation. And again, if we skip over that, we're missing a lot. And this is not ever something that I follow in like a linear fashion with people. It's just to give people an idea that at some point we'll probably do all these things together. But the decreasing inflammation is such an important step to kind of getting your life back. And there's so much systemic inflammation with Lyme and tick-borne diseases. It can be, in the brain, often the gut, spinal cord, organs, and there's been damage that's been done if you've been sick for more than 3 months, and these organs and systems that have been damaged really need to be recovered. And I feel like that's often where treatments are failing, because again, I just feel like there's a little bit too much emphasis on only killing things. And a lot of people don't know to have that lens and have that perspective and how powerful it can be. And also with the inflammation often comes scar tissue, which can prevent the medicine from going where it needs to go. And I really work with people to decrease inflammation. There's so many different ways to do that, which I'll go through some of them. Anti-inflammatory diet is really key. and really important. And I find that kind of just jumping to the supplements and not addressing that is important. And sometimes people aren't ready for a complete anti-inflammatory diet. So we, just work with people with what they're ready to include or exclude from their life and what support they have too from family or friends. So that's a big part of it as well. And often work with people, if there's access to far infrared sauna, that's another tool for, helping calm down inflammation. And then I'm just always coming up with unique, individualized herbal and nutritional programs kind of based on labs and symptoms and again, what people are able to do. So some examples of some natural remedies for inflammation. Because again, it's like I'm not talking, yes, I'm talking about more of the natural remedies, not so much like ibuprofen, things like that are, again, have issues when you take them long term. So people are often familiar with turmeric, and this is a picture of some turmeric, what it looks like fresh. And turmeric is a super antioxidant. It supports liver function. It's really potent anti-inflammatory, helpful for chronic pain. It also does a lot in the digestive system. It helps to actually increase the diversity of the gut microbiome, which, as a lot of the research is coming out more and more on how important that is for the immune system. And if you've been on antibiotics for any amount of time, more than just a couple of weeks, that's really important to support that gut flora and that has been probably wiped out at that point. And so, but it also improves intestinal barrier function, decreases intestinal inflammation. So all important for if you do need to stay on the antibiotics for long term. Curcumin is the active constituent of turmeric, and that has protective effects against heavy metals like lead and cadmium and arsenic and mercury. And those are all things that can inhibit immune function. It could be one of the reasons why you could still be sick even though you've been on antibiotics. It's one of those 9 reasons. Environmental medicine is a big part of naturopathic medicine. Again, it's not something that most medical doctors or in conventional medicine, they don't always look at environmental medicine, what exposures you've had, mold or toxins and things like that. But it's a huge and important field, especially in our world right now. So these things can inhibit immune function and cause a lot of neurological damage. So it's important. So turmeric is one of those things we might use to help with that. It's also been used, it also has help for mood, like it helps with anxiety, fatigue. And one thing it does, I mentioned it helps with liver function, but it actually can help protect against liver injury and liver toxicity when we have what's called polypharmacy. So with tick-borne diseases, if you're going to like a Lyme or MD, you could be on multiple drugs, right? You could be on multiple antibiotics, medications, things to deal with the side effects, and liver toxicity can complicate or delay the treatment. And antibiotics account for 45% of drug-induced injury. And really the only treatment is to discontinue the medication. But curcumin, again, one of the active constituents of turmeric, has been documented to significantly reduce liver toxicity in patients on tuberculosis drugs. And tuberculosis is just a good correlation for long-term antibiotic therapy for the tick-borne diseases, because when you're on the TB drugs, the tuberculosis drugs, you're on that for like a year or more. So often people have antibiotic resistance and all the same issues. And often turmeric can be taken in many different forms. I work with some really sensitive patients, so we use a more nutritional aspect, and that's like you might have heard of a golden milk, and what that is like milk, and it can be any kind of milk. It doesn't have to be cow milk. It could be almond milk or anything unsweetened. And you add some turmeric powder and some cardamom and some other herbs and spices, and you warm it up, and it's a nice thing before bed. It's actually kind of calming and can help you sleep. But you can also do capsules, you can do tinctures, things like that might be easier. And Japanese knotweed is something that people might be familiar with. If you're a gardener, it might be something that you're not so happy about. It's considered an invasive plant, but it actually has a lot of really good uses just for a lot of different things, not just for tick-borne diseases. It's really helpful for brain inflammation. It helps improve thinking and memory. There's a lot of studies showing it's helping prevent dementia. Can decrease brain fog and fatigue. And brain fog, by the way, is a sign of brain inflammation often. Another herb that and one thing I want to say about Japanese knotweed is, which you might have heard if you've looked into any of the herbal protocols for Lyme, is that it's very common. We kind of mix it with a lot of other herbs. And Japanese knotweed, a lot of herbalists talk about how it precedes the coming of Lyme to a certain area. So there's herbalists who just kind of like watch, the Japanese knotweed came first and then the Lyme disease came afterwards. And it's also used for joint inflammation. So it's a good herb for Lyme. There's a lot of people using it adjunctly for cancer treatment as well. So another herb I often use is milk thistle, which is in the artichoke family. It's also another super antioxidant and liver helper. So again, could be helpful for preventing any liver injury if you're on a lot of different medications. And one thing you might or might not be familiar with is systemic enzyme therapy. So enzymes, a lot of us are familiar with digestive enzymes being used, but they really help, enzymes in general help, they're catalysts for everything in the body, help the body work better. And when we've been sick for a long time with any of these tick-borne illnesses, it's like nothing's really working very well, right? So it's just kind of like giving our body like some help to make sure like all these processes are working well. But systemic enzyme therapy also can break down scar tissue and plaques that the spirochetes form around themselves to protect themselves so that the antibiotics don't get to them. They can help break down products of inflammation, so useful for pain, and just assist with the basic body functioning. And there's different enzymes kind of target different systems of the body. So nattokinase is made from soy, and it's used a lot in cardiovascular disease to kind of help break up those arterial plaques. But it's also helpful then for breaking down plaques, again, like around that basically the spirochetes like to really form these communities, and they have some viruses in them and some heavy metals, and then they form this protective like biofilm plaquey thing around them, kind of like the film on our teeth, but stronger than that. And that's one of the ways they can evade antibiotics. So it's helpful sometimes when you're doing antibiotics or antimicrobials to also use the enzymes so that the medicine actually gets in there. And steroidepeptidase, some of you might have been on if you've gone to like a holistic or functional medicine doctor. So just going into this a little bit more, is, some of you might already know if you've been with Lyme Action Network, importance of getting treated really soon, ideally within a week, ideally within 72 hours of noticing any of the top warning signs of an acute tick-borne disease, right? So fever, flu-like symptoms, sudden onset of sudden onset of digestive issues like nausea, diarrhea, the type of fatigue, like you're just not ever going anywhere, you're not getting out of bed, intense pain, intense mood swings, really rashes of all kinds. I've seen all kinds of rashes with, an acute tick-borne illness. It's not just the bullseye, and it's not just, I've seen red patches. There's also the disseminated Lyme disease where you can get multiple bullseyes. I've seen all kinds of rashes. And brain fog, again, it's like just not holding any information in there. Sudden onset of extreme pain anywhere in the body, migrating pain, sudden, intense mood swings, anxiety, depression, especially in children, feeling surges of energy. So I get the idea of intense sudden onset of something. And of course, there's many more symptoms you could get with an acute tick-borne disease, but that's just the general, most common ones. So again, unknown co-infections, primary care offices, and even infectious disease offices are still not testing, not aware that they exist, or it's not in their protocol, so they can't test, not doing the right tests, all of that. And just as a plug again, I think you guys talk about this in your organization, but when you test the tick, much more accurate. If you're lucky enough to find a tick, and I say lucky just because then you can test the tick and find out like what the tick is carrying if you do get sick. So it's much more accurate to test the tick than test human blood. And also it's lucky if you find a tick, because then your primary care doctor will be more likely to give you the treatment that you need. So another thing is just, I find there's just too much reliance on labs and not enough symptoms and the clinical picture. It's not how medicine is actually intended to be practiced. It's just in Western medicine and conventional medicine, we kind of got like really so focused on the technology and all the imaging you can do and on the labs. And really it's not even how medicine is practiced, like with a lot of other things, right? You're supposed to be like using the labs to kind of confirm or to help you diagnose something. It's not supposed to be an end all be all. And just because there's so many issues, there's so many false negatives with the tests, and we don't have a good system for testing tick-borne diseases. It's really and because you want to get treated, with a lot of the tests, like the Western blot, the antibodies aren't going to show up 4 to 6 weeks later, but then you need to get treated right away. You need to get treated within 72 hours. You can't wait 4 to 6 weeks. So, yeah. So anyway, some primary care doctors around where I live, like in Southern Vermont and in Western Massachusetts, are getting better, and they're not waiting, and they're like, okay, we're getting you on the medication, and then we'll test later. So that's good. I'm seeing more and more of that. I hope you guys are in your area as well. And so then there's also the myth of like, if you've had 4 to 6 weeks of doxycycline, you're no longer dealing with Lyme disease. But we know antibiotic resistance is common, and I'm going to go more into some of that in a little bit. Autoimmune activation, you might or might not be familiar with this concept, but autoimmune disease is like your body is attacking itself. It's becoming more and more common that we're seeing this, and a lot of it is because we just have more toxins in our environment that we're having to deal with, and our food is also just like less healthy and more toxic, and that's sort of one of the causes of that can be one of the causes of autoimmune activation, but so can viruses and bacteria can trigger an autoimmune process. And so sometimes you're not dealing with an active infection, but it's more of an autoimmune process or disease at that point. And some of the common ones that are associated with the tick-borne diseases are rheumatoid arthritis, multiple sclerosis, psoriatic arthritis, celiac disease, and then I've also seen like Hashimoto's and Graves', Hashimoto's and Graves' are more related to the thyroid. And I'll talk more about that in a little bit too. And one thing I'll also go into in a little bit more detail later is this concept of identifying and treating chronic viruses. If you've been in the Lyme community for a while, you might be familiar with it, but you can have chronic viruses along with anything that you can get from a tick. So any of the tick-borne diseases, some of the tick-borne diseases are viruses like Heartland virus. And sometimes you have chronic viruses that kind of have, but basically you have mono. So you have like swollen glands and fatigue and sore throat. And normally you wouldn't get those things, but because you've had Lyme for so long and the immune system is so weakened, you just get kind of more and more vulnerable to these things that your immune system can't fight off. Kind of like a similar model to how we might look at HIV and AIDS, and how people have, all these other things that normally their immune system would be able to fight off. So another thing that I find is missing, another reason why you could be still sick, is again like identifying and restoring the depleted organs and systems back to function. You know, again, it's possible if you have been on some different antimicrobial therapies, it could be just simply that your adrenal organs are taxed. Your adrenal organs are really these tiny little organs that sit on top of the kidneys, and they're what produce cortisol and a fight or flight response, and they help us deal with stress, and it's very stressful for the body to constantly be having to fight off an infection, and at some point things just sort of you know, get tired basically, and need some support. So heavy metal toxicity is also another reason why some people are still sick and not getting better. The spirochetes can form plaques. Again, like I said before, they can form this community, and then they form these sort of protective devices around them and can have heavy metals in them, can weaken the immune system. And these can come from like our dental fillings, they can come from our food, environmental exposures. So it's something that is important to identify. And then lastly, mold. Mold is a neurotoxin. It definitely needs to be avoided. It can just worsen everything with the immune system and the nervous system, brain, digestive system. I had a patient that came to see me in Vermont, and it was just like she was so sick. She'd been living in this house that hadn't been built right, and the whole foundation of the house had mold in it. And you know, contractors, it was a new house that they had built, and the contractor just did a really poor job, and it was awful because she couldn't live there anymore because she just was so sick. You know, she had vision problems and nausea and memory impairment. You know, she couldn't think clearly. So it's something that you can have alongside with the tick-borne diseases, and is important to identify. So just another patient story here. And I'm just going to stop this again just to make sure. Okay, I think everybody who's here is here, so we're good. All right, start that again. So let's see if this will go down this way. There we go. So just another patient story is this was an older woman, about 65, with twitches and sleep issues. Sleep issues are kind of common with Lyme. Sleep issues and like mental health things are not often talked about in conventional medicine, but we just see this, you know, over and over again happen so much because the brain and the nervous system just get so damaged and attacked by the pathogens, and they just sit in there for years at a time sometimes. But sleep issues can range. For some people, it's like trouble sleeping and insomnia and anxiety, and that was the case with this woman. But for some other folks, it's really more related to sleeping too much, kind of like with this sloth here. So she had been on antibiotics for 6 months, and her symptoms returned after marital stress, which, you know, we often see that as well. The stress, different stressful situations, whether they're good or bad, right? Like something positive, like getting married, can still be really stressful, right? Or, you know, starting a new career, or whatever it is. Or just being able to go out and socialize after you haven't done that for a while. So moving, you know, anything, and any other stressors we're dealing with now, moving, staying at home, you know, being afraid to go out, all the, you know, fires in California, you know, everything that we're dealing with can cause flare-ups. And she was frustrated because she wasn't getting anywhere with the herbal or pharmaceutical antimicrobial therapy. And she wasn't sleeping, she had anxiety, she had heart palpitations, and she was, I think she was using, she was also self-medicating with alcohol to fall asleep, and she was frustrated because she couldn't predict, you know, when she was gonna feel bad. Her life was on hold, and I'm sure some of you can relate to that. And this is why decreasing inflammation, especially in the nervous system, so nervous system being the brain and the spinal cord, and then just all the peripheral, all the nerves that kind of lead to all the other parts of the body. So decreasing inflammation in the nervous system and identifying other reasons that you could be sick, you know, is really, besides just the antibiotics or the antimicrobial herbal approach, is important. And it's why I always work with people to balance the nervous system. Sometimes with the nervous system, it's overactive, sometimes it's underactive and depleted. And so it's important to balance the autonomic nervous system when there's sleep and mood issues. And, you know, sometimes people get really severe mood swings and anger. And we see this a lot with young people, children. So, and then again, this story kind of amongst the others really kind of highlights also the idea, debunks the myth of like, there's no Lyme after antibiotic therapy, right? And in conventional medicine, they often call it post-Lyme syndrome. But we know that there's evidence of spirochetes hanging out in connective tissue in its sort of inactive form, just waiting for a trigger like an inflammatory process to wake it up again. And even as early as like 1998, you know, in different infectious disease journals, they were talking about how Borrelia burgdorferi spirochetes could be cultured. You know, it's hard to culture them from the blood, but they were able to culture spirochetes from the blood of patients with Lyme disease, even with those sort of previously aggressively treated with antibiotics. And so there's really no double-blind study to determine the optimal duration of antibiotic treatment for Lyme disease. But we know there's lots of evidence that if it's stopped before symptoms resolved, then often the patient will relapse and Lyme disease will progress. And even though it's really hard to culture out the Borrelia burgdorferi or BB spirochetes, or, you know, they're really hard to culture from your blood, there still are like a lot of well-documented culture confirmations of the persisting BB infection in antibiotic-treated patients. And the spirochetes have even been cultured from patients who have been given intensive, meaning 21 days to 1 year of antibiotic therapy with IV third-generation cephalosporins, which is a type of antibiotic that is often used IV-wise. And, you know, how many of you have heard or people have told your family members, you know, you don't have Lyme, it doesn't exist after the acute phase. You've had the antibiotics, that's it, you're done. You know, there's nothing wrong with you. And it just can be so infuriating. So I just want to talk a little bit about some of the things, some of the mechanisms, or just some of the ways antibiotic resistance is, why it's common. You know, sometimes it's the delayed treatment. You know, when we have the delayed treatment, it can lead to later stages of Lyme, tick-borne diseases. It's harder to treat, more debilitating, more money, costs more money, more disability. And again, ideally wanting to treat within 72 hours of initial symptoms. And so one of the ways that talk about antibiotic resistance is this idea of round bodies forming with, and there's a lot of documentation of round bodies with doxycycline. And round bodies are basically a type of persister bacteria that appear resistant to like the first line antibiotics for Lyme disease, like doxycycline and cefuroximine. And so what happens is there's sort of these mutant forms, they call them mutant forms in the literature, of the Borrelia burgdorferi. They develop resistance to antibiotics in several ways. One is that, so normally bacteria have cell walls, that's what identifies them as bacteria. And one of the ways that antibiotics are developed is to target that cell wall, and that's what penicillin does. And so what happens is these mutant forms actually lose their cell wall, and that's often why penicillin isn't effective for Lyme. And then also some of these forms also stop replicating, which is kind of interesting. And so that also takes away one of the antibiotics that kind of work by, they're called replication dependent antibiotics. So that sort of takes away that part of it. And then we know they can invade the immune system by releasing what are called these blebs. Just imagine like a blob. And it basically binds the free antibodies. So antibodies are, you know, what your body produces to signal other parts of the immune system, like, hey, there's something wrong here, we got to kill this thing. And they do other things as well. But, you know, antibodies, you might know if you're in the Lyme community, is that's what a lot of testing is based off. So what happens is you have these blebs that these mutant forms put out, and they bind the free antibodies. So then, of course, you come up with negative Lyme Western blot assays and ELISA tests, because those are only detecting the free bodies. And another thing I think I mentioned a few times is the scar tissue that can form from chronic inflammation, and that's just any chronic inflammation, not just related to infections. So I had a patient with a chronic, well, we were treating him for a number of different things, but it really wasn't until that was identified that he had like a Babesia co-infection along that had a lot of scar tissue, and then it wasn't until the scar tissue was addressed that he really was able to start seeing, getting better. So why use botanical medicine? Then I'm going to go through some of these different things, but botanical medicines can often reduce antibiotic resistance. This is sort of the positive flip side of like, yes, there is antibiotic resistance, but there's things we can do about it. So a lot of botanical medicines can reduce antibiotic resistance. There's a lot of synergistic effects with antibiotics. They help them work better a lot of the time, provide protection, as I was mentioning with the turmeric. They can provide sources of novel antimicrobials, which is like new antimicrobials that are not part of a drug. They're anti-inflammatory and immune modulating. They can prevent and treat side effects, and they have really good safety records. So, and herbal therapy, even in the US, is like, pretty common. It's different in different communities. Some places it's more accepted and more normal than in other places. But according to a survey by the National Center for Complementary and Alternative Medicine, herbal therapy was the most commonly used alternative medicine when they took out prayer. And then there's some different surveys, like 22,000 adults in the United States, about 13% took at least one herbal supplement. And then there's like another one that says 42%. So there you go. And some examples of these, besides kind of what I've talked a little bit before, but in terms of like more hard research, there's a trial from China that was, I forget what year this is from, but it was talking about the use of a traditional Chinese botanical formula plus antibiotics to see if it, helps the recovery rate or the cure rate in any way, versus just IV penicillin. And so it was a small study, 39 subjects. They had been infected for 6 days to 2 years. They met all the CDC case definition criteria. They had fever and neurological symptoms, heart symptoms, meningitis. And so there was 2 groups. One was IV penicillin plus a Chinese medicine botanical formula versus just the IV penicillin alone. And they did find that the cure rate was just statistically better in the combination group that did receive the herbal therapy versus the control group that just received the antibiotics by themselves. And there was quicker resolution of symptoms observed in the combination group. And that's kind of basically what I've seen clinically as well, is just the herbs just help decrease so many of the side effects, and they help the antibiotics work better, help to decrease a lot of this antibiotic resistance. So one of those herbs I really like using is Chinese skullcap. It's called Scutellaria bacalensis, but you can just say Chinese skullcap. That's the Latin name. And it's neuroprotective. It protects the brain. It's antioxidant, anti-inflammatory. One of the main constituents, baseline, was found to have, it basically has like antimicrobial activity against some of these different mutant forms of the different Borrelia species. And it helps to protect against the round bodies. It helps to protect against biofilm formation. And it has its own antimicrobial activity. It's also antiviral. And it has a lot of synergistic effects with antibiotics, as well as a documented clinical safety. And so a lot of these things come from other places. They're not things that a lot of the botanical compounds that we use are kind of coming out of research from China and from Russia and from other places that basically have more of an integrative medicine. and, you know, that's more nationalized and more accepted. So that's why we see a lot of these things, Chinese herbs and things like that. Another one like that is the artemisinin, and that's what this plant is here pictured. This is from my garden. I always grow wormwood. It's in the Artemisia family. And it's not the same thing as what I'm going to talk about, but it's related to it. So, and it looks similar enough. But this is the plant I'm going to talk about is Artemisia annua, which is called Sweet Annie. Some of you might have heard of artemisinin. It's basically a compound. It's one of the active constituents of the plant, and it's really the second most effective agent for the Borrelia persisters, the round bodies, in combination with other antimicrobials. And we use it a lot in Babesia infections, because Babesia is very similar to malaria in its clinical presentation, its treatment, its symptoms, its pathophysiology. It's one of the co-infections, one of the tick-borne diseases, and it's a parasitic infection. So using doxycycline on it doesn't help. And relapsing is common. It often comes in these like 6 weeks waves. It's a really common co-infection or tick-borne disease, and there's longer duration of symptoms with it, especially if it's not identified. And if you do test for it, you know, at the wrong time, it's only replicating every 6 weeks. It might not always be active. But artemisinin, which is one of the active constituents of the Artemisia annua plant, is well established worldwide as a treatment for malaria. So a lot of the treatments for Babesia, we look to malaria basically. And so Up to Date, which is a sort of like a resource clearinghouse for physician assistants and nurse practitioners and MDs. It's a database that you can go to, and you can look up like quickly like how to diagnose and treat something. And so they actually recommend the standard antiparasitic medication, atovaquone, plus the artemisinin, and plus or minus an antibiotic as a treatment option for the persistent and relapsing Babesia. So even in a US-based conventional database, they recommend it. So the whole plant, and there's also talk of the whole plant being able to reduce antimicrobial resistance, and that's a whole other conversation of like, do you use the whole plant or do you just use the constituents? So just to recap here is that you can still be sick, and have Lyme or a tick-borne disease even after the standard course of antibiotics. There is such a thing as chronic Lyme disease. Long-term antibiotic therapy can be dangerous. It's not always effective for all the reasons we discussed, and there are some holistic treatment options available to help with all of that. So again, part of my unique approach is identifying the cause or the causes, like we talked about, like those 9 reasons. You could still be sick, coming up with a unique customized botanical medicine, and identifying and treating organs and systems. And so I just want to not going to talk too much longer, but I just want to highlight a little bit on the autoimmune activation and the chronic viral infections, because they might be concepts you haven't heard about. Again, autoimmune disease is basically your body's attacking itself. In the conventional Western world, they still kind of have a lot of unknowns of like the causes of this, but bacteria and viruses are one of the things that we know can trigger the immune system. And again, it might not be that you have an active infection, but you could have an autoimmune process, or you could have both going on. And common ones associated with TBDs, the tick-borne diseases, are rheumatoid arthritis, multiple sclerosis, Hashimoto's, Graves, celiac, but there's a lot more. It's not just those ones. And so the National Institute of Health estimates that there's really more than 20 million people in the US that have autoimmune diseases. Most of them are women, but it's really on the rise and becoming more common. And there's research in the rheumatology community on incidence of Lyme, and then an autoimmune diagnosis 4 months later. And that's mostly with the rheumatoid arthritis and the psoriatic arthritis, because that's the rheumatology community. And then if you look at the infectious disease community, in the literature, they talk about long-term exposure of the immune system to spirochetes basically may induce chronic autoimmune disease. And they talk about pro-inflammatory and immunomodulatory and suppressive features caused by the pathogen. And what that basically means is that you have been, when you're just exposed to these infectious diseases for so long, they cause so much inflammation, and they basically are, you know, trying to take control of you're the host, right? So they're trying to like live inside of you for as long as they can, and they're trying to evade the immune system. So they do all of these very sophisticated things to basically suppress our immune system and to change it. And so what that means is that you could have, on either side of it, you can have an overactive immune system, which can lead to an autoimmune process where your body is just like fighting itself so much and just getting confused about what's, you know, self and what's the bacteria. And especially when things start hiding out in different places, it gets confusing. And there's all these different mechanisms to avoid the immune system. And then on the other side of that is you can have a very suppressed immune system that is also caused by the pathogen, because your immune system is like trying to keep up and trying to keep up, and it just kind of goes out a little bit at some point. So a naturopathic approach to you know, treating the autoimmune diseases, or you know, similar anti-inflammatory diet, identifying environmental toxins, healing the gut, decreasing inflammation, balancing the immune system. So it's similar to what we do with Lyme, but again, it's just individual based on what people need individually. And you know, with autoimmune disease, there's certain herbs that activate the immune system, and so we don't use those when there's a autoimmune process going on. And then with the chronic viruses, they can occur with a weakened immune system, like I mentioned, or a tick-borne disease itself. And basically, when you're dealing with the viruses that are not from a tick-borne illness, you know, normally you wouldn't be so vulnerable. Your immune system wouldn't be so vulnerable, and you could fight off these chronic illnesses. And these are mostly in the herpes family. They're called Epstein-Barr virus and cyclomegavirus, and they cause mono-like symptoms like the swollen glands and the sore throat and fatigue, and sometimes neurological symptoms. And sometimes people just have those things and don't have Lyme or tick-borne diseases, but you can have co-infection, you can have a chronic virus, you can have, you know, multiple things going on all at the same time. So, and they don't cause necessarily like herpes. You know, we think of like it's herpes family because they're in the same family, but they don't necessarily cause a herpes lesion. And then the other thing I like to mention is that that I'm seeing being talked about a little bit more is just identifying any viruses that ticks might be carrying. So heartland virus is, you know, mostly coming from the south. It's because it's on the Lone Star tick, and so it was first discovered in 2009 in Missouri. And so you might be saying, oh, we don't have the Lone Star tick here, we're good. But people travel. Where do people get dogs? People get dogs from the south, and the tick, you know, hitches along on the dog or on the person, right? So they can travel. And I do see this with some of people with chronic illness, and it is something that the CDC talks about, and you can get tested for even, you know, at a conventional lab. And the initial symptoms of it are very similar to those of ehrlichiosis, and those include like fever and fatigue, anorexia, nausea, and diarrhea. And so they, you know, it's something that should be considered when someone is being treated for ehrlichiosis and they're not responding to treatment with doxycycline. So what we talked about, what you've discovered, is what a holistic approach to Lyme and tick-borne diseases might look like, along with a short introduction to what naturopathic medicine is, why you might still be sick, even though your labs are quote unquote normal, and you've taken antibiotics. And we talked a little bit about my unique approach to Lyme recovery. So again, some of this is assessing and treating the weakened organs and systems, balancing the nervous system, decreasing inflammation, healing the gut. And I just like to always put in here, you know, who this is good for, and who this is not good for in terms of like working with someone in a more naturopathic way. So I'd say this is not for you if you just want to keep taking antibiotics, you just want to keep doing what you're doing, you're opposed to herbs and dietary changes or lifestyle changes, and you don't want to take an active role in your healing. And then say conversely, this is for you if you do want to take an active role in your healing, and you want to focus on nutrition and herbs and lifestyle changes. And you're maybe at a point where you can't take antibiotics any longer because your gut can't handle it anymore, your intestines can't handle it anymore, or you've just kind of reached treatment failure or a plateau and you're just looking for something else. And then again, like my Lyme discovery recovery system is designed to help you get your life back, help you sleep better, have less pain, more energy, clearer thinking without just having to rely on medications. So what I wanted to share, instead of me going into, I'm going to share my website with you briefly, and then we'll go into your questions. So this is the email this is my website, and then this is the email you can reach me at. But you can also contact me at my website, and I'm going to share that with you. Just give me one moment here. Okay, so this is my website. I'm trying to get off these other things. So this is a phone number and stuff, but if you want to contact me, so if you are interested in being on I have a separate mailing list from Lyme Action Network, and I was put on there different events that I'm doing, talks, sometimes different information about herbal products that I might have available. It's for people who are either just interested in learning more, and there's also current clients on it as well. But you can go to my contact page and just contact me this way, and that's cedarroseheals.com is the website. And then in here is also services and appointments, and I just wanted to let you guys know that I do have a free 15-minute appointment available. It's a consult, and so it's really just a chance to ask questions and for us to get to know each other and see if we would be a good fit to work together or not. It's not a place where you get any medical advice or look at labs or anything like that, but it's like a meet and greet basically. So you would choose, let's say you want this time, you would go here and you say you're not an existing patient, and then you put all your information in here. So that's pretty much that. I am going to, stop the screen share. So we can go to your questions now. And again, just looks like some of you have typed some questions in the chat, and I think Chris will be just asking the questions in the order that they came in.
If you can see them, you can just go ahead and answer them. I mean, I think you can see there were about 6 that came in. Can you see them, or would you like me to read them?
Yeah, I'm not sure. So Tiffany had a question of, do you have these in slides, the knotweed, etc.?
That was the section talking about enzymes and knotweed and those.
I didn't have separate slides for all of those. Okay, going to bed. Thank you. Can you ask your doctor to do a blood culture to see if you have spirochetes? No, you can. I have never really seen a blood culture test. Does anybody have any other information? I mean, it's very, very expensive, so insurance definitely would not pay for it. And it's not like a standard IGeneX test or anything like that. Maybe
I
Holly
can weigh
knows.
in on that if that would
Yeah.
help. So in New York State, that kind of test is not, it cannot be ordered by physicians in New York State. If you are not in New York State, it is possible that your physicians could order the test. IGeneX actually does that. but it is very expensive because insurance companies will not pay for it.
And what is it called?
I'm not sure what they're calling it, but it is the method that was developed by Eva Sappi that the lab that IGeneX actually merged with, that was in Pennsylvania. What was that, the name of that lab? That I can't remember. So anyway, moral of the story is it is available, but I think it's rarely done, and I don't think that it's feasible for most people just because of the cost. It's very expensive.
Yeah, and it's expensive because anything that you're culturing, but especially with blood, it just takes a really long time. And
right, so it's not very actionable. You know, the culture test, it may be positive within a few days, a few weeks, or up to 12 weeks later. So waiting that long for a diagnosis is very difficult. And I have to say also, with the treated patients who are on antibiotics at the time that the blood is taken, you know, generally speaking, patients who have been treated and are no longer under treatment, that's the study that you were talking about. But generally speaking, if you're on antibiotics, the spirochetes are elsewhere, they're in biofilms, they're not in your blood. So when they take the sample to try to culture the spirochetes, they probably would not appear.
great, thank you. So somebody has there's a specific question here, which I can't really give any specific medical advice. It says, would love a list of 2 to 3 things I can take while on Doxy. Yeah, so I would say that's more of a consultation type question if you're talking about your symptoms and things that you can do. I'm kind of more, I mean, the standard, I could tell the standard, you know, Lyme protocols that you'll find online are like the Stephen Buhner protocols, which include, you know, Japanese knotweed and angiographis. You can look those up on your own. So it's like Japanese knotweed, angiographis, smilax, and cat's claw. But I'm not a fan of just sort of giving blanket information because we don't know you, and you could have, you know, other medications you're on that are contraindicated with some of those things. And so it's definitely, you know, kind of better to work with a herbalist or someone that knows you better and can kind of work through all that. Yeah.
The other half of that question had to do with hydrochloroquine, which is probably you know, such a famous word these days that
right.
probably a lot of people are very either nervous or disgusted, you know, with hearing so much about hydrochloroquine. But I guess the question: do you see patients who are on Doxy and hydrochloroquine?
Not very much, because I'm not. Yeah, not very much, just because I'm not prescribing. I'm not prescribing medications, and even when I was prescribing medications in Vermont, it was really just like doxycycline and, you know, herbs and probiotics and very basic things, and then other herbs for co-infections. So it's not something that I'm super familiar with. I have had some autoimmune patients on it, but what was the other? Yeah, so you probably are in good hands with the person that you're seeing, though. It was Tiffany who wrote that question. And there was a question: do you treat patients for autoimmune diseases besides Lyme, tick-borne diseases, for instance, celiac? Yes, so definitely. I have a lot of patients that I treat with celiac disease, and Graves' disease, Hashimoto's, you know, even type 1 diabetes, all kinds of things. And sometimes there's people that don't have like a diagnosed autoimmune disease, but, you know, some of their autoimmune markers are positive, and I think they have an autoimmune process, but they don't have a diagnosable disease. And some of the things we do naturopathically work for that as well. And then sometimes I've had people who've had celiac, and then they also have a tick-borne disease, and that's kind of where things get more complicated and can be sometimes harder to treat, or just that there's like more severe symptoms because it's already like your body was already kind of set up in this very pro-inflammatory way. Somebody wrote advanced labs. Is that?
That's the lab, yes. Thank you, whoever did that. Thank you.
Somebody's scratching a tick on their screen. That's funny.
Oh, of course it was Jeff Levy, our board member. Of course you would know that, Jeff. Thank you.
Okay, so somebody, and then Laura says, had son take the lab culture test to see if he had cleared the infection, had gone off antibiotics for 4 weeks. $600 to $750 is the cost. After 16 weeks, a small amount of Borrelia was still there. Cool. Well, not cool, but thank you for sharing that story. Those are all the questions that were in there. Do we have time if anybody wants to unmute themselves for a question? And who wrote the question about Nancy, did you have any more specific questions about the autoimmune diseases?
No, it was really because I have a daughter that has straight up celiac, not just a gluten allergy. So I wondered if that meant she could just be seen by you to be treated for that, but then you might also find out that she had been bitten by a tick at some point. I don't know.
Mm-hmm.
I just was curious if you would start out with that premise of, yes, I have celiac, what can you do for me?
Yeah, definitely. I mean, Lyme is kind of Lyme and tick-borne diseases, I would say, is probably maybe like half of the clinic, half of the clients that I'm helping have Lyme, and then it varies. Maybe it's 30%, and 30% it's gastrointestinal issues, 30% it's autoimmune diseases. So, yep, and definitely, and sometimes there's more than one autoimmune disease too.
Right.
And with something like celiac, it can be, it's like, oh yeah, it's just we think of it just as in the intestines, but it can really affect the brain, and it can be systemic, just like a lot of other things. So yeah.
And interesting that you said you could also treat type 1 diabetes. I didn't realize that.
Well, it's not treating it. So it's more just like, I wouldn't be the main doctor on board with that. The way that I work, especially in Massachusetts, is that I'm kind of working in general. This is with, tick-borne patients, Lyme patients, any patients really, is that I'm kind of working on because I have limited scope of practice in Massachusetts and I can't prescribe, I'm usually working with like a team of people. So people will have like an MD or like their primary care, or a specialist or a nurse practitioner that they work with. Sometimes there's a few doctors on the team when there's, it's really complicated, and I try to, I work really hard to communicate with everybody on the team. But yeah, so, but there are things that, well, yeah, again, like sometimes we just have more time with like our clients and patients than a lot of even, nurse practitioners and nurses have with their patients. And so we, with something like celiac or diabetes or something like that, we might be spending a lot of time talking about nutrition with people, because they don't have the time, other practitioners don't have the time to talk about that.
I had a question. I typed it in and I don't know if it was addressed.
Yeah,
but,
I don't see it.
About the botanical aid for lichen planus. I was just diagnosed with that.
Oh, yeah. Oh, sorry. I did see that, and I think I was like skipping it because I'm not able to give out, like, I don't know that much about lichen planus, and again, I don't really give out like specific medical advice and health advice on talks like that.
As part of the autoimmune, it's an autoimmune disease, so I didn't know if you treat people with autoimmune diseases, how you would, I'd putting creams on for weeks, and it does not disappear, the spots I have.
Yeah, so I would say that would be more of a consultation that would be better for a consultation to kind of go into all the things that we might do for that. But I mean, autoimmune disease, there's a lot of different autoimmune diseases. Some of them are more focused, some of them are more systemic, and some of them are more involved with organs, some of them are more on the skin. And so there's like some general things that I do with everybody with an autoimmune disease, and that is like identifying any environmental exposures, including like food, pesticide exposures, heavy metal exposures, dental fillings, things like that. Identifying like any toxins in the environment that could be, because in naturopathic medicine, that's kind of a big part of what we think are a lot of the triggers for a lot of the autoimmune diseases. And then, I'm always working on healing the gut with people and what's going on with your immune system and the connection with the gut and the brain, and looking at nutrition. So there's a lot of different things that I generally do with autoimmune patients. And then it's different, of course, like depending on what the actual illness is. So off the top of my head, I don't know a botanical aid for lichen planus. Yeah. And then Tiffany also had a question about what is Mycoplasma pneumonia, IgG, IgM, is it a co-infection? So yeah, Mycoplasma pneumonia is there's different types of mycoplasma. The Mycoplasma pneumonia is kind of like walking pneumonia. But when we're talking about a tick-borne illness, there is also mycoplasma. And the IgG, IgM is the antibody test that your doctor would test to basically see if you have a positive infection or not. Anybody else have any? We still have some more time. I guess I could also, if people don't have other questions, I could talk about the other things I was going to talk about, which are just sort of common questions that I usually get from people. So let me go to my list to see. So it talks about people, in terms of like if I can see people from New York State. So I don't take insurance, and New York insurance doesn't cover naturopathic doctors anyways. So it's pretty much all out of pocket, and I can do, I'm doing virtual consults and telemedicine and kind of work with people, like I said, pretty regionally and then across the US as well. So I can definitely work with you pretty much wherever you are. And, there was other questions I usually get are, do you treat children and young people? And the answer is yes, but there has to be kind of like a team on board for that. And again, it kind of depends on like how severe the symptoms are, because I have limited scope of practice in Massachusetts, and I don't provide like emergency services for people or after hours care. So as long as there's some, a pediatrician on board and somebody, usually with pediatrics, it really depends on, again, the severity of the illness and what's needed. I would say with, I have seen a lot of children kind of like from ages 2 up through 18 when I was working in Brattleboro, and I'm pretty comfortable and familiar with, using a combination of integrative approach where we're kind of looking at botanical medicine and nutrition and other supplements alongside of, a pharmaceutical or conventional or like a Lyme literate MD approach. So, and sometimes I get questions of like, do you have to stop seeing all your other doctors, which I think I've basically addressed, saying, no, you don't have to stop seeing all your other doctors. And I usually try to work and communicate with other people. There are some Lyme literate MDs that are just adamant about how they only want to be the only doctor. And I just, even when I had that ability to have full prescription rights and primary care and all that, and access to, labs and everything, I don't really advocate that approach, because I think, sometimes when there's really complex illness going on, you need, sometimes you need another perspective. So, all right. Are there other questions about anything?
Just want to say thank you to everybody for putting this together. It was great.
Good. Yeah, and if there's any helpful for us to know, like, yeah, or for me to know if anything was useful or like to know more about.
I thought it was very, very. I think it's the kind of thing that this population appreciates, because everybody, that pretty much everybody we know has some sort of a physician on board, one way or the other, 99% of the time. But as you pointed out, it isn't necessarily the be all and end all of, self-care counts in this game. So it's really, it's an important and really very interesting perspective. I really appreciate that you came on, Nytia, and I appreciate everybody else who has come on and asked questions. We were hoping for a lot more people, but I think it was really fortunate that we just had a nice intimate group tonight, because it gave everybody a chance to have some questions answered. And also I appreciate Nytia, your respect of people's personal situations, because one of the things I heard you say was that if you have, for example, an autoimmune disease, you don't want to be giving somebody something that stimulates their immune response. So it's like, oh, well, gee, that's a good idea. And so that's why, it's important not to give people very, kind of like generic information that they might do something that really may not work in their best interest. So I appreciate that sensitivity. If nobody has any other questions or anything else, and nobody seems to want to play a game with all the people here that we have on our screens,
I have one question,
Okay.
and I'm frustrated trying to send the chat. For some reason, I don't see the button to send the chat, and I have something typed, but it didn't get sent.
Okay. Sure.
But someone was talking to me about muscle testing recently, and they claim that was effective in treating Lyme. And what's your comment on that?
Well, muscle testing is basically a form of it's not a form of formal conventional diagnosis, but it's like a form of, it's a way to figure out what's going on with someone. It's not really a treatment. And so the idea is like we're working with the autonomic nervous system, and you're testing to see you can test for different pathogens and metals. And the doctor I mentioned before, Dr. Klinghardt, he has like his own system called the autonomic response therapy or treatment or something like that. And he has his whole own system of how he does kind of testing through the nervous system. And it's really dependent on the practitioner. Like some practitioners are really good at it and some of them are not. It's not scientifically based in any way. I mean, it's not like hardcore science based, is I guess what I mean by that. It's kind of, anyway, but it can be very highly effective way to figure out sometimes what's going on with people, especially when we know how poor the the lab testing that we have available is. And then sometimes people will go through, it's not necessarily a form of treatment, but sometimes people will test different supplements or medications with muscle testing to kind of see what your body's response is to it. And so people who are the practitioners who are really good at it, I don't do it, but practitioners who are really good at it, it can work really well. So you kind of have to, I would say if you're, thinking about working with a practitioner like that, you would want to probably read their reviews or talk to some people who, went to that practitioner to see if they were helped or not.
Okay, thank you.
Yeah.
Will this recording be made available either on Lyme Action Network or on your site so we can share it with others?
I'm going to take my next leap into learning how to do things and try and put this thing up on the Lyme Action Network YouTube channel.
Oh,
I have instructions for that. So that's going to be my little job. Don't hold your breath waiting for it, but it will get up there sooner or later.
Great.
I don't know how hard or easy that is. And Nytia, are you going to put this up on yours?
Yeah, I'm going to put it up on my website in the next couple of weeks. Yeah, I do have a section that I don't need to show it to you guys again, but there is a section on my website, I think under the services bar for Lyme, where I have all the webinars and interviews I've done. So I'll put that on there as well. Yeah.
Terrific. That's great.
Great.
Yeah.
So,
Great.
well, and once we get it securely, anchored to these sites, then, we'll notify people that it's available, and then you can pass it on to the people would be interested in it.
Great. Thank you.
Okay. Everybody all set?
Thank you very much. I appreciate everyone's attention and questions, and Chris for making this all work. So thank you.
Well, thank you. We really appreciate you being here. And with that, we'll say good night to everybody.
Yeah.
Thanks very much.
Good night.